to achieve, and the 5 tests that the First Secretary has just mentioned for adjusting the lockdown. And the slides that I'll go through now show how we're progressing towards that. And the first thing here really is to reinforce the action that people have taken. Sorry, could you revert the slide? Thank you. Just to show how much people have been following those social distancing rules and really helping to bring the rate of infection down, but also to be protecting each other. So the number of people avoiding contact with vulnerable people, of adults, 92% have avoided contact with older or vulnerable people in the last 7 days. So really looking out for each other. And in general, 82% have not left their home or only left their home for all the reasons that we know that you should. And that has reflected now in our much reduced R rate and the opportunities that we have going forward carefully to be adjusting the measures. I think the other interesting thing looking forward is 44% of adults in employment have now said they've been working from home at some time in the last week, significantly changed from the 12% for the same time last year. And that helps the social distancing, but I think it also perhaps helps people recognise other opportunities for how they can work in the future. Next slide, please. So here we see the daily tests, which have increased. So the tests yesterday, or rather up to 9 o'clock this morning, carried out were 86,500. There has been a little bit of a technical hitch in the lab over the weekend, but that's now starting to rise again. And we will see in the following slides how that translates through to our detection of disease. Next slide, please. And here we have on this slide, so the blue pillar there is the NHS swab testing. The rates of case detection are coming down. These are primarily within healthcare settings in hospitals, but the orange pillars on the top there represent the increased capacity and numbers of tests that are being carried out. And obviously, we hope overall that our case numbers will come down, but in this intervening period while testing is increasing, then we expect those orange pillars to grow. So we will have increased case detection, but we want to watch the blue pillars coming down as they are now. Next slide, please. And this slide, which we've seen before, but I think with some trepidation at the top of those peaks, we can now see that just about all regions have come right back down to relatively low levels compared with the peak. Of course, I say relatively, that for the number of people in hospitals, that still represents a huge workload for NHS frontline staff, but it does show a decrease of 16% over the last week. Next slide, please. And again, reflected from that last slide is the use of critical care beds. At one time, there was obviously concern that with the rising epidemic, we would have sufficient capacity. There was a plan to manage that, and now less than a third of critical care beds are occupied by COVID-19 patients, and that's been decreasing right across the UK over the last 2 weeks. Next slide. And here we have the 7-day rolling average. Now, obviously, sitting behind this are recorded deaths, none of which we would wish to be there. But on the positive side of that is the fact that we can see the rise in the epidemic peak and the subsequent later deaths. There were 539 deaths in all settings following in the last period, but the 7-day rolling average now is a midweek one, which is the most robust figure. We can see the variation over the weekend periods in that slide, and this is the lowest, I think, that we've seen since the end of March. Again, really importantly, that all the social distancing measures, all the things that we've been doing, we need to keep doing to maintain that gradual decline in the line. Next slide, please. And then finally, just a quick comparison. It's important that we compare data internationally. and this is global death comparison, but as we've mentioned frequently, there are variations in how different countries measure those deaths, and these are numbers rather than rates. Thank you.
Jenny, thank you very much. I think we've got a string of questions, and first of all, Thomas from London.
Safe to lift any lockdown measures, considering that our track and trace system is not yet operational and that our comparatively slow decline in daily deaths means that we have little margin for error?
How safe is it to lift any lockdown measures?